Take our lead. Let's help you make your mark. Our goal is your satisfaction. Let us show you the way.
For some people, ovulation comes with a bit of blood or spotting. Spotting is any bleeding that happens outside of your regular period. Spotting occurs in about 5% to 13% of menstruating people, 5-6. Ovulation bleeding probably occurs in 5% or less of people, 5.
Take our lead. Let's help you make your mark.
Ovulation bleeding is vaginal bleeding during or immediately before or after ovulation, which occurs roughly in the middle of a menstrual cycle. Changes in estrogen levels are often the cause of this type of bleeding, and light spotting around ovulation does not usually signal a serious problem.
Take our lead. Let's help you make your mark.
Spotting after ovulation may be a sign of pregnancy. This is usually called implantation bleeding. It happens when the fertilized egg implants in the uterus. It occurs around the time you are expecting your cycle to start, but you will notice significant differences relating to your normal period.
Make your mark. Take our lead.
Estrogen causes the endometrium to thicken, and peaks at ovulation. Progesterone rises at that time to maintain the endometrium. If insufficient progesterone is present at the time the estrogen begins to drop, spotting may result. This spotting usually lasts from 1 to 3 days and is mid-cycle and is not cause for concern.
Take our lead. Let's help you make your mark.
Dr. Bradley, as long as the patient is not taking oral contraceptives, OCs, mid-cycle bleeding is most likely ovulation bleeding. This type of bleeding is predictable, occurring 10 to 16 days after the onset of the patient's last menses, light, and lasts 12 to 72 hours.
Make your mark. Take our lead.
Schropp says to see a gynecologist if you are experiencing any of the following: bleeding that requires more than one tampon or sanitary pad in an hour, for several hours in a row. Bleeding or spotting between periods. Bleeding after having sex.
Take our lead.
Bleeding between periods often happens when you start to take hormonal contraceptives. This is because your hormone levels drop. It is also called breakthrough bleeding, and usually happens about 2 weeks after your last period. Breakthrough bleeding should stop after 1 or 2 months.
Thank you for watching. Please subscribe and hit the bell notification.